This segment is brought to you by Netcare. You're in safe hands.
Enlargement of the prostate is called BPH. This occurs when the cells of the prostate multiply. The swelling causes a squeezing against the urethra, which limits the flow of urine. Joining me today is Dr. Kelpie, a urologist from Netcare Parklands Hospital. So Dr. Kelpie, you are a urologist here at Netcare Parklands Hospital. So today we're going to talk about prostate. So for the purpose of our viewers, let's first talk about where it's located and the purpose of it.
So the prostate gland is a gland that sits below the bladder, and the job of the prostate gland is that it helps with fertility. When you're younger, you need your sperm to travel, and it adds fluid nutrients to allow the sperm to travel. We don't really know why it happens, but it does happen that there's a 50% chance at the age of 50 and 90% chance of the age of 80 of this prostate getting larger.
Let's talk about the complications with a prostate getting larger.
What does happen is, if you can imagine, you are passing through, or fluid is passing through this ring or this donut, and as this prostate gets larger, it restricts that opening. So many guys come in with difficulty passing urine. They are straining, having to force to pass. They dribble after they pass. They find that they're not able to empty the bladder completely. They might even have incontinence, which is involuntary leakage of urine. In extreme circumstances, they might not be able to pass at all. And that is an emergency. Patients come in saying, I can't sleep, I'm waking every hour. And they think there's something wrong with the bladder, but it's actually the restriction placed by the prostate where they're not able to empty.
Why do you think the male is so stubborn that they do not want to seek help right at the early stages?
I mean, if you get cut, I mean, do you need to put a plaster on it? You know, so I would say no. So
I would say yes.
so it varies, but in most cases, it's just that, you know, why try and hunt for problems when it's not really a problem? There's also a degree of fear in that I'm having this problem, difficulty passing urine, I might have cancer, and do I want to know if I have cancer or not? And that whole circle, you know, it makes it quite difficult.
Hi, my name is Paul Shannon from Durban. I think at my age, a lot of people, the men, talk about prostate cancer. I'd known about prostate cancer, and I'd had a problem in my family, and a few of my uncles and my father had cancer. So I did have some ideas, and I did know about procedures, but most of them I'd known were fairly invasive, so I'd never entertained it actively at that stage.
My name is Dana Pillay, and I'm a retired professional academic. I did have a problem with my prostate. It became enlarged. I had a TURP done, and it provided me with some relief for a short while. A year later, the prostate became enlarged again, and that is when I contacted Dr. Kelpie.
So if you have an enlarged prostate, does it mean that you have cancer?
No. So an enlarged prostate in most cases is not cancer related. It's only 10% of patients that come in with an enlarged prostate we find cancer. So it's by far the least likely problem. The most likely problem is benign prostatic hyperplasia. We call that BPH. That is the most likely reason for you to have problems.
Let's talk about the treatments available. Let's talk about some of the older treatments. And then I do believe that there's a new treatment called HoLEP, which you are the first in South Africa to perform this procedure.
Yes, correct. So for treatment regarding the prostate, normally we would start with medication. And medication that we use helps to relax the passage to allow you to pass a bit better. Medication does have its drawbacks. There's quite a number of side effects that you could experience with medication. So we normally would entertain medication up to a certain point, knowing that the prostate is a growing gland, it's going to keep growing, and you're going to reach a point where it's not going to work, or at the outset, it's not ideal. In the 1970s and 80s, they devised cameras, and the technique that is most often done would be that you go in with a camera and you use a hot knife or current to rebore the prostate. That's called a TURP. And so you're basically opening a channel to allow urine to pass through. That also has issues with bleeding, so you would have a catheter for about 3 or 4 days in hospital, and you'll be washing the bladder with this fluid and so on. And then look, from where I come in and what my interest has been, what has happened in the world since 1997 was that there's a movement towards, we call it enucleation procedures. And the most often technique of doing an enucleation is using a laser. I go in with a camera, and where the prostate is, I use a laser to peel off the prostate from the capsule that sits around it. So it's almost like peeling an orange from the inside.
If we had to compare both procedures, let's talk about the benefits of each and which one you would prefer.
With regards to the scraping procedure, the TURP procedure, that to me is outdated, because what we are saying is that we're reboring a passage. There's prostate that's always left behind. You have bleeding as a major problem that will cause you to have a catheter for 3 or 4 days in hospital with blood transfusions and the like as a possible complication. And with HoLEP, the way we're doing it now is that it's done as a day procedure. So what would it entail is that you come in the morning and you would be under anesthetic, and my general procedure takes me about half an hour to 45 minutes now. Our team, the theatre team and our nursing team in the ward are very slick. We've done more than 230 procedures now. So they know exactly what happens and what we should be able to do. And the idea is that by the afternoon, by 3 or 4 in the afternoon, you're discharged. Now the benefit of the procedure is obviously that we are removing the gland at the level of the capsule. We are enucleating, and with that, we're not expecting you to come back with bleeding. We're not expecting you to have a regrowth after a few years. And bleeding, and essentially your flow of urine is far superior than it would have been with a scraping procedure.
We did a grid biopsy, and then Dr. Kalpi informed me that there is a new technique, the HoLEP therapy, and I opted to go for it. And I was pleasantly surprised. I was under anesthetic, but I went into theatre in the morning. I think it was a Tuesday, and by Wednesday morning, the bleeding had subsided, had stopped, and I was discharged the next day. There was minimal pain. In fact, I felt no pain, no side effects, and so on. I've been quite well since then, and this was in 2018, early February when this took place, and in March, I went home, rested for about a week, and in March I led a normal life.
Initially extremely quick in the first couple of days, and I was home quite soon, and thereafter there was some discomfort for a while, and I came in and had my visits with Dr. Kalpi, and we worked on whatever problems there were and solved those problems ongoing, but they didn't last for too long. I don't have any problems at all. I think mentally it's a big help knowing that you don't have this problem inside you, and secondly, the quality of life is almost back to normal. Certainly there's no ongoing problems. The side effects which were discussed with me are with me, and they don't affect my life in any negative way.
So Dr. Kelpie, as the person who brought this procedure to South Africa and being the first person that has completed this procedure, are you involved in the training of other urologists?
Yes, so that's an important part of my job at the moment. And so I have a colleague in Italy and in France, in Paris, that has shared their training techniques with me. It's always daunting with this procedure, especially that it's technically demanding for the urologist, because it's a different way of looking at the anatomy. And it's always advisable to have someone with you when you're training. I had recorded video when I started each case and sent it off to my mentor, and he critiqued it, and that's where I come in at the moment. The idea is to have centers in all of the major cities and spread it across Southern Africa. I have colleagues in Kenya that are quite interested as well, and Mozambique and so on. So what we're doing currently is that I have 8 mentors that I am currently training, and a lot of my time is spent with them, trying to get through the procedure, and yeah, that's what we do.
What advice could you give to our viewers, our male viewers in particular, who are sitting there and have never had their prostate checked?
What's interesting is you said male viewers.
Yes.
But it's very often that we find that female viewers and female, the wives or
Yes.
partners come in saying, look, my husband has this problem. He's not very forward with this. I find that he passes urine 4 or 5 times at night, and I need to find out what's going on. So it's always advisable that you should have yourself checked with a blood test, a PSA, have a prostate examination done if you're above the age of 50. And there are treatment options out there that will be able to help you and improve your quality of life.
I think quality of life is the most important thing.
Absolutely. Yeah.
Thank you.
Okay. Good.
This segment is brought to you by Netcare, You're in Safe Hands.